All right, we're going to start this video out with talking about the airway metric system and the easiest way to get started, finding the perfect bite position to take your bite registration, and also finding a perfect position for where your target position is going to be as you titrate your patient forward to decrease their snoring and improve their AHI and oxygen numbers as you treat the patient with the mandibular advancement device. So let's start with the Snort Screener. So I've opened up my Airway Metrics kit, and this little thing right here is called a Snort Screener. And this is a super simple, easy way to first see which vertical might be best for your patient. So we're going to take our little pretend patient here and use this little model. We're going to take our little Snort Screener, and this first little notch, there's a tiny little notch here for the lower incisors for the patient to bite down into. And the first thing they're going to do is bite down right here, and they're going to slide their incisors into that little notch here on the bottom and ask them to try to make a snoring sound. That's a 4 millimeter vertical. All right, so just see kind of what snoring sound they make, if any. And then as you go up, we're going to go up to 8 millimeter vertical. And again, we're going to try to get their lower incisors in that little notch. You can see as they do that, they're not in a edge-to-edge position necessarily when they do this, but that's okay because we're just going to check their vertical. Okay, have them try to make the snoring sound with that 8 millimeter vertical. And now one more, let's go all the way up to 12 millimeter vertical and see if they can make that snoring sound in that position. Now that's very open, very significant vertical opening there, but just see if there's any major differences, and that could be a good starting point. Now I do normally try to keep most of my patients either at 4 vertical or 6 vertical or 8 vertical, with 4 and 6 being my preference. But for some patients, you may need to go 10 or 12 potentially, but like I said, I try to stay with the lower verticals to have less risk of jaw pain or TMD problems. Okay, so that would be the first step, is just using your Airway Metrics Snort Screener to see what position the patient has an easier time breathing with. So in other words, does the snoring sound go down? Is the volume less? Is it harder for the patient to make that snoring sound? That's your first start. And then we'll go more into whether we want to try the 4 vertical, 6 vertical, or 8 millimeter verticals, and how to choose where to start as far as edge to edge, or whether we want to start the patient in a more retruded position. And that will depend on where the patient's overjet is. So in other words, does that patient have a small overjet, maybe 2 or 3 millimeters, or do they have a larger overjet? Okay. All right, so let's start out with an example here. So I'm using this prosomnus model as our example. Let's say you have a patient that has about 2 millimeters overjet. In that case, you can more than likely start them at end to end. Now, if they had a larger overjet, so let's say 4 millimeter overjet, 4 millimeters to bring them forward to end might be a little too much. We may not want to start them that far forward. In that case, I'll show you what we would do in that situation. But first, let's start with a straightforward case of, let's say they've got 2 millimeters overjet. We're going to maybe try a 4 millimeter vertical and a 6 millimeter vertical, and we're going to start end to end and see if the patient can snore. So let's start with our 4 millimeter end to end, and that's this middle row right here. It's a 4 millimeter vertical, and it's end to end. So those notches, top and bottom, meet up in the center, and that's end to end. So what you're going to do, it doesn't matter which end that you place inside the patient's mouth, because when it's end to end, they're going to be with their top and bottom teeth edge to edge. Okay, so, and you do try to center it as best you can between the top and bottom teeth. And you also try your best to keep the patient from sliding their lower jaw forward, because see how if they aren't really protruded far enough forward, the positioner is going to tilt downward. You don't want that to happen. You want the positioner to be parallel. You want it to be horizontal and not rotated down. So just make sure the patient keeps their lower jaw forward for you when you're taking the bite registration. The other thing you're going to look at when you try these in, and you're not going to look at this right away, more so after you've chosen your correct vertical or your correct position you want to start the patient in, look in the posterior and just make sure that you have clearance in the back. Make sure there's not a molar that has a cusp hanging down that's going to interfere with your clearance space. Typically you need at least 3 millimeters of clearance in the posterior and preferably 4 millimeters. You can get by with about 3 millimeters for the Panthera nylon appliances, but most others want you to have 4 millimeters clearance in the posterior. So just double check that before you take your final bite registration. But again, do your best to center this on the anterior. And this is a good example of, you know, obviously this sample has nice straight teeth, but if you had some crowding, you may have to adjust where you position the little positioner. It can still be used. You'll just have to be careful that you still maintain a nice end-to-end position for your bite registration. So let's say this patient has a 2 millimeter overjet, and we are going to start out with this 4 millimeter end-to-end. So if they've got a 2 millimeter overjet and we're starting end to end, we've already protruded them 2 millimeters forward. Ask them to try to make a snoring sound with this in their mouth, and ask them how comfortable this is. And you know, they may not be able to really answer. Usually it's not uncomfortable, but they may still be able to make a snoring sound. They may not be able to. This is just going to be the first one that you try for end to end. See if they can make a snoring sound. And then go ahead and to the 6 end to end. Okay, so we're going to go to the next one down in the middle row, 6 end to end. And same thing, we don't have to worry which side we put in their mouth because it's edge to edge. And we're going to center it between the top and bottom incisors. Okay, so centered. And see, that would be an example of someone like letting their lower jaw fall forward. So we want them to be edge to edge as best they can. That looks pretty good to me, maybe right there. Okay, so this is a 6 vertical, but again, they're protruded 2 millimeters from their natural bite. So we have them protruded, even though it is end to end, it's 2 millimeters forward. Have them make another snoring sound. See if they can make a snoring sound and see if this feels any different to them or more comfortable. This may feel more comfortable to them than the 4 end to end did. So just try to see if that's any different. And then if they're still snoring at that position, just go ahead and work your way down the line and go to the 8 end to end and have them do the same thing and see if that's comfortable. See if they can still snore. Just get feedback from them on that. And typically you want to start with the lowest vertical that you can. So if they're able to snore in the 4 but not able to snore in the 6, I would go with the 6. If it's pretty similar between the 8 and the 6, I go with the 6. If there's a huge difference like between the 8 and the 6 and they're not snoring with the 8, go with the 8. But if there's no huge difference, go with a smaller vertical. 4 or 6 millimeters are my typical go-to on the vertical. Now, if they're still able to snore in any of these, then go ahead and move their lower jaw forward and see if they can still make a snoring sound. See what their comfort level is when you move them forward by 2 millimeters. So we've tried the 4 end to end, we've tried the 6 end to end, and we've tried the 8 end to end. Let's try the 4 vertical with 2 millimeters protrusion past end to end. Okay, so in our example, we've got a patient with a 2 millimeter overjet, 2 millimeters. When we tried end to end, that moved them 2 millimeters forward. So now we're going to move them another 2 millimeters forward. So we have, you can see this better. See the notches here where it's 4 vertical and then the 2 and the 3 notch. Whichever number is inside of the patient's mouth, that is the number of the actual protrusion forward. Okay, so your lower notch is for the lower incisors, and the upper notches are for the upper incisors. And you would flip it around if we want to have 3 millimeters versus 2 millimeters. So I'm going to show you what that looks like. So we're going to do a 2 millimeter overjet, or 2 millimeter protrusion for this patient. Lower incisors are going to go in this notch, and the 2 notch is going to go inside the patient's mouth. Okay, so the 2 notch is going to go on the upper incisors, and the lower incisors are going to go into the bottom notch. This is going to move the patient's jaw forward 2 millimeters. I don't know how well you can see that, but the number 2 is in the patient's mouth. And move that lower jaw. Again, we want this parallel to the ground. So we want that lower jaw protruded another 2 millimeters. So that's why the lower jaw is in the 2 notch, or in the central notch, and the upper incisor is in the 2. Okay, so, and think back about this. The patient's natural overjet is 2 millimeters, and now we have them protruded an additional 2 millimeters past end to end. So that's 4 millimeters of protrusion this patient is in this position I'm showing you. So that's a total of 4 millimeters protrusion. Have the patient try to make a snoring sound in this position, but again, make sure this is parallel. Don't, if they let their jaw slide back, that could just put them right back to end. So make sure that their lower jaw is forward and see if they can make that snoring sound. And so that's your 4-2. Let's try a 6-2. And again, that the 2 millimeter notch is going to go inside the patient's mouth on their upper incisors, and that lower notch is going to go on the lower incisors. So it's whatever number is in the patient's mouth is the number that they are protruding. Okay, you're going to try that position, ask the patient if they can snore. Find out which one's more comfortable, which one's less comfortable. Typically, the more they have to protrude forward, it's a little less comfortable. That doesn't mean it's going to be a bad thing or not going to work. It just means, you know, it's pulling their muscles a little bit more. So, but again, make sure that they don't let their jaw drop back like this. That's not an accurate representation. You're not going to get a good idea of whether they can snore or whether that's a good position. You want that positioner to be parallel to the floor. Okay, so that was the 6. If you want to, you can try the 8. I don't usually try the 8. The 8-2-3. Okay, so we've tried 4 vertical edge to edge, 6 vertical edge to edge, 8 vertical edge to edge, and now we've tried 4 vertical with 2 millimeter protrusive and 3 millimeter protrusive, and we've tried 6 millimeters with vertical with 2 millimeters protrusive. Okay, so let's say we have a patient who has, let's say they've got 4 or 5 millimeters, let's say 5 millimeters of overjet, okay? So those upper incisors are 5 millimeters in front of the lower incisors. Okay, if we start this patient at edge to edge, that's too far forward. That's probably going to hurt their joint. So we maybe want to start them 3 millimeters forward, so they come forward 3 millimeters in protrusion, but they're still not edge to edge. So you got to think about it from the patient's point of view. They're coming forward 3 millimeters. They are in protrusive from where their starting point was, but that doesn't mean they're edge to edge. They'll still be, if you move them 3 millimeters forward, they're still going to be 2 millimeters from edge to edge. Okay, so how will we do that with these airway metrics?
Watch this next video as I go over how to choose your bite registration position for patients who have a greater than or equal to 4 millimeter overjet.